Good morning, good afternoon, hello, wherever you are. Welcome to another Friday's Coaches Collab. We are happy to have you here. This is the place where we have real talk about real pets and our real reasons why we became holistic pet health coaches. I am holistic pet health coach Melissa Tansen, and I am joined today by my colleague, Tanya Bashase. Tanya, so happy to have you here today. How are you?
I'm doing well. Thank you for having me. This is a lot of fun to do these, so
It is a
I'm
lot of
excited to
fun.
get started on these. Yeah.
Yeah. We had a fun conversation yesterday, and you've got a really interesting story and background. And I'm excited that we get to share it with our other colleagues and also any of those of you who are pet health enthusiasts that are excited to get into health. Tanya is here, and she's got an interesting and diverse background, and we're going to learn more about that. So, Tanya, um, one of the reasons that you got into holistic pet health coaching is you had a pretty tragic series of events that happened with your dog Topher, who has since passed. And we're going to get into Topher's story a little bit more, but I kind of want to hear that story from your mouth and how it became the catalyst for you getting to where you are today.
Sure. I actually love to share it. We'll see if I can get through without crying, but
We're here for you.
yeah. So Topher was a rescue. He was found in the streets in Kansas. He was pulled and put in a kill shelter. He was neutered at 3 months of age, and then a border collie rescue had pulled him from there, where he spent a month in foster care, and then he came to me. So we were excited to have him. But anyhow, because of his early neutering, he had 2 knee surgeries before he was 3 years of age. So 2 TPLO surgeries that he recovered nicely from, and did really well with the recovery and the physical therapy that had to go along with that.
That's a tough surgery, and it's tough when they're that young.
Yeah, he was a trooper, right? He wasn't allowed to do a lot of things, right after surgery. But he was so funny because he would just stay in his place. She didn't even have to put him in his crate. He knew that he wasn't allowed to go anywhere. And he even took he would even take toys and pile them up next to him because nobody else was allowed to play because he wasn't allowed to play.
Oh,
So,
what
you
a
know,
sweet boy.
awesome. But yeah, anyhow. So at about 8-ish, 9-ish, he started to develop arthritis in his spine because his gait was slightly off because of the 2 knee surgeries. So our first border collie, Tanya, had arthritis in her hip. And so I had already started researching some holistic options for her to get her off some of the meds. So I was well prepared when he started developing arthritis. And I was even more prepared actually because I'd learned much more since Naya's passing. And so, understanding that a little bit more. So he went to chiropractic care. He got, laser therapy. He went swimming, anything that I can think of, right? He was doing.
That's
He was on
fantastic.
CBD oil, he was on a good diet. So we were managing well. He was doing great. And then August 8th, 2020, he woke up and he just wasn't feeling good. And, at first I wasn't worried, but he didn't want to eat his food. And then I looked at his gums and his gums were pale.
Oh, boy. And
Yeah,
that's
so I
not a
was,
good sign, anybody who's
no,
listening. That's emergency situation.
right. So I called my vet and I said, hey, do you think you could see him today? And she said, yeah, absolutely, bring him in. So of course it was during COVID and, you had to drop him off, type scenario,
That
and
was,
leave him. And
yes,
it was just, so they were making us take the collars off. I don't know if you remember that, but we
I
had to take the
do.
collars off in order for him to be seen. So I
Oh,
just remember taking his collar off, and handing him over to the vet tech, who I know and love very well. But I just started crying because it
of
was
course.
like I just felt like there was something different about this episode, and I couldn't figure it out. But anyhow, He had fluid in his abdomen, and she was able to identify that it was blood. And so that was the start of basically his hemangiosarcoma diagnosis.
Oh
Um,
gosh, that's.
he,
Can you, Tanya, just real quick, can
sure,
you, for everyone that's listening, can you just give us a quick explanation of what hemangiocarcinoma is so as we're going along with your story, we can all understand?
sure, absolutely. So it's a very, very aggressive blood cancer. And with if you decide to do nothing, generally they only get a couple of weeks to live. And some actually will die on that first bleed because they're not able to absorb the blood. If you do if you do surgery where you remove the spleen and sometimes other organs along with that, then they usually get 2 to 3 months. Um, if you do surgery plus chemo, then they generally get about 5 to 7, 8 months ish.
Oh, wow.
And only 10% of the dogs will last over a year.
Oh
So
my
that's
goodness.
how bad this cancer is. So if
Those
anybody
are
here,
staggering statistics.
right, if anybody ever hears the word hemangiosarcoma, oh my gosh, please reach out to me. I know so much
Yeah,
about it.
please reach out to Tanya.
Yeah,
Has really done her research in this. Her heart and soul was in this because of Topher, her dog she's talking about right now. And it's a tough one. Okay, Tanya. Well, keep on going,
yeah,
dear.
yeah. So anyhow, luckily Topher absorbed the blood from that first bleed, and my vet was able to do an ultrasound and determine that there was masses on his liver and spleen.
Oh,
So at that point, she tried to get me into an oncologist, but of course, as we know, COVID, right? There was a shortage, and so it did take a couple of weeks. When I finally got into the oncologist, he took a look at his x-rays and basically said, this isn't really a dog that I would normally do surgery on, because it's pretty aggressive. But if you want to do surgery, I'll do it for you, right? So it was a big decision, but we ended up going with the surgery. They removed his spleen and they removed part of his liver. There was a nodule in the middle of his liver that they could not remove. And so, that already put him at a disadvantage. But he came out of surgery well. He was such a trooper. He did everything well out of surgery.
it's always
And
amazing
then,
how these guys just are so resilient, it seems, at the toughest of times.
right. It's just amazing to me. And his belly was all black and blue. It was just
Oh, goodness.
disgusting, but I iced it every day. We did stuff holistically for him, in addition to what was going on, from the vet world. But
Yeah.
anyhow, so we ended up going through 2 chemo sessions, and again, he did well. I don't know that I would ever do chemo again personally, just seeing what he went through. But that's hopefully I don't have to get to that point again.
Right.
But on his third chemo session, he was having a bleed. And so the oncologist wouldn't do chemo, and it was the right decision. But he, was strongly advising to think about, putting him to sleep. And, I said thank you and basically took him. But the next day I had an appointment with my holistic vet. And I had 2 holistic vets that I was working with anyhow, throughout this entire process, even before, right? But she was able to make him a little bit more comfortable.
Yeah.
But it was kind of a rough couple of days, and I ended up taking him to the ER, to the same vet where the oncologist was. And the oncologist basically lectured me for half an hour in the parking lot, because we weren't allowed to go in again, on how I should put him to sleep right then and there. Um,
Oh, honey, that had to
and
be tough.
yeah, it was not pleasant. And I basically
You're
said
already emotional
no.
enough. Right.
Yeah, right.
Right.
I said no. I said, give me my dog. If I'm going to do it, I'm going to do it in a non-sterile environment, meaning I'm going to take him home with me and
Right.
we can do something there.
Have memories happy.
Yeah. So, the very next day, again, I had an appointment with my holistic vet, and she said, you know, absolutely not. Like, I'll tell you when you've gone too far, but he's still happy, he's still eating, he still wants to do things. There's like just he's still got life in him. And
He wasn't
so
telling you it was time yet.
exactly, exactly. So she was able to give us one more month of life, which was incredible. We got to do things with him that we wouldn't have gotten to do if I listened to the oncologist, a month prior. And a month may not seem like a lot, but in this situation, it was. So from the time he was from the first bleed to the time he died, we got 3.5 months.
Wow.
Um, so, but during that time, I was researching everything I could find about hemangiosarcoma, every treatment, anything we could do holistically for him, anything we could do medically for him. So we basically did a lot, everything I could think of. And we got 3.5 months.
Well, this is your
But
baby, I
yeah,
think that's the thing is when our babies are going through something like this, we will go to the ends of the earth and back to try to find something that could possibly help them. And I can see that and hear that in how you're talking about Topher and what you did in your heart. And I just want to take a quick sidebar and mention that this is Tanya's heart and her passion. And it's the passion from this experience and the heartbreak that she had to go through that she uses every day and her steps going forward as a holistic pet health coach. So I just wanted to mention that when you've got a holistic pet health coach on your side, know that they have been through something profound that has spurred us all to go this direction. And we're going to find out more about why Tanya did go this direction. Go ahead, Tanya.
yeah. So, after Topher died, and he was having a rough day the day he died, but I didn't think it was the end. So I kissed him goodnight, and I went up to bed. And then my husband had taken him out to go to the bathroom and basically told him, Topher, it's okay, come on. And he basically collapsed in the garage. So, and then my husband came up and got me, and by the time I got down, he was already gone.
Oh, Tanya.
But it's
I'm so sorry.
yeah, thank you. It's awful. I never want anybody to have to go through what I went through. But when I was done, I had all this knowledge that I wanted to share with people. And it just like it was eating at me, right? Because I felt like I could help so many more people with all this knowledge that I had, but I didn't know how to do it.
Right.
So, it was just like amazing, something like you talked about, that hits you and you end up doing all this research and everything else, and it spurs you to want to do something bigger and better. So
I think we all just are thinking there's got to be a better way. There's got to be a better way. So, how did you find out about the Dr. Ruth's Holistic Pet Health Coaching Program? How did that come about?
So I was scrolling on Facebook one day, just like everybody else, and the ad popped up, and I'm like, this is interesting, right? So I looked at it, and I'm like, well, this could be a way of sharing everything I know, and learning more as I go through it. So I was skeptical, just like everything on Facebook, but eventually I made the inquiry and had the initial consultation with, and I apologize, but I don't even remember who it was with, but I remember grilling her on every question I could come up with. And then even
Yeah.
afterwards, right, I had like a ton of questions.
The
'Cause I
per
was just
people working on the other side of Dr. Ruth's program, I've heard that they've gotten grilled pretty hard. They can handle it though.
yeah, she was very good. She answered my questions.
Yeah.
And I took a couple days, but at the end of it, I just kept on thinking this was a way that I could help more pets. And like I love the fact that Dr. Ruth had all this information that she put together on just about every subject that you want to think about, to try and help pets. Like, it's certainly not a substitute for veterinarian care, but it's a good complement.
Right.
Because we were able to give pet parents different options, which, the vets don't necessarily have time for one or even know about in some cases. So,
Absolutely. I always like to think of it as, we talk a lot about how we need vets. We love vets. We need them for a lot of diagnostic things and we need them for the diagnosis. And in a lot of cases, there are some medications that are needed. If you have a dog that's, in chronic heart failure, they're going to need some heart medication. However, I like to think of it as we're the place where we bridge the gap. We are the bridge because vets are very much in a diagnostic pharmaceutical type vein, most of it, unless we have wonderful integrative holistic vets like Dr. Ruth. And there's a lot of wonderful integrative vets. But what we do is we take the time to study what the holistic treatment may be, holistic being mind, body, and soul. Because when we've got a pet that is sick, we know that it's not just one thing. We can't just treat the one thing or support the one thing. The vets are most often treating one thing where we want to support the whole body. Because at the end of the day, if the body has the right foundation to be healthy, then we know that we can work forward and get them on a pathway to health, which is what we ultimately want. So here's where we come in. We look at diet, we look at supplements, traditional Chinese medicine, whether there is an environmental factor or a stress factor. And we kind of come in as that compassionate guide that can, first of all, guide and give suggestions where the veterinary knowledge may end. And I think they're a wonderful complement to each other. And that was a really good point, Tanya. So how long was it after little Topher crossed the Rainbow Bridge, and you becoming a holistic pet health coach?
it was a couple of years because
Okay.
I kept on doing things locally. And so I would help pets locally, but I didn't have anything behind it, right? It was only the situations where I had knowledge that I could
Hmm.
share what I knew.
Right.
So I didn't have the platform into the entire knowledge that I needed to really help. And so that's where this course was very helpful, in that, it gave you the information and it gave you the support. So, you know, all the coaches, we all help each other out when we, can't get to exactly what we're looking for. And so just the support from the coaches and Dr. Ruth has been phenomenal. So, I mean, um I can't thank everyone enough for like welcoming me into this community and, helping me when I needed help. So, we all need a little bit of help now and again. And
Okay.
so it's just awesome that we can all do that.
I couldn't agree more. And I pinch myself and I'm grateful every single day that I have colleagues like you and all of our wonderful colleagues. The resources that we have and the amount of continuing education that we have every day is enormous. We are learning every single day from guest lectures to meeting with Dr. Bruce, from talking with our colleagues. We like to say that if one of us doesn't know what's going on, there will be one of us that knows. And so once again, when you've got a holistic pet health coach, you have the backing of an entire team of integrative nutritionists, and holistic experts all behind us. So it's really been wonderful. And I love that we can have this huge network of us. And so, Tanya, after you graduated and became a certified holistic pet health coach, you started Healthy Paws and Whiskers.
Yep.
I love that.
Thank you. It was, I wanted to try and make sure that I incorporated both, kitties and dogs. And so I was trying to figure out a way of doing that. So
So
I
tell
thought the
me, oh,
Paws
I'm
and
sorry.
Whiskers was cool.
I love it. I love it. I know sometimes there's sometimes we want to make sure that we have our little kitties in there too. A lot of us sometimes get wrapped up with dogs because there's a lot going on in the dog world, but there's also a lot going on in the kitty world too. And we can't forget about our little felines, little picky pantses that they are. I have two kitties, but I know we talked about kind of my struggles with Darla and how I got where I am. And sometimes I think the kitties are like, "Hi, I'm perfect, but why don't I get any attention?" And Darla, meanwhile, is like, "It's all about me." But okay, so you've got, speaking of little pumpkins, you have 3 dogs now. Tell me about them and tell me how you're doing things differently now that you're a holistic pet health coach.
So I have 3 border collies. The oldest one is Tarek. He's 8 years old. And he's a little pistol. Like he's been trouble from day one, and he's teaching us patience at every step of the way. And so he's my seizure dog. He received a rabies vaccine in 2020 and started developing seizures
Oh
and some
no.
aggression issues afterwards. So worked with a homeopathic veterinarian to try and get those more under control. All of my dogs are all whole foods fed. They get real food for starters as a good nutrition base, and then I do supplement their diets because I'm crazy, right? And I want
You're
to
not
give them
crazy.
the
Our
best that I
food is
can.
depleted.
Right. I want to give them the best I can. So I do supplement their diets a little bit. But for him specifically, I have him on some Chinese herbs, CBD and mushrooms. And, knock on wood, his last seizure was in January. So we're about 6 months in, which is a good stretch for him. He was having seizures like every full moon, actually.
Wow.
Um,
Whoa.
yep. I
Now
can't
that's
explain
a
it. He was
rabbit
having it.
hole that we could go
Yeah,
down.
right. Yeah, I know. But every full moon,
Interesting. Every
he
full
was having a
moon.
seizure. Yeah.
Well, we definitely love CBD dog health. We love Myco Dog for the mushrooms. There's links in the comments, and you can get to Dr. Ruth's site where you can find out more about CBD dog health and Myco Dog. Okay, my mind, I don't know if you can tell, is secretly trying to draw all the connections between the full moon and the seizures. Okay.
It is. Yeah,
We
and
may
I was
have
doing
to.
the same thing. I did, but
I
we
think we
we got
should.
past
Should we poll the audience? We should. Let's do it.
it.
We haven't
Sure.
done this before. Okay.
Okay.
Our holistic pet health
Technology.
coaches.
You're gonna have
Yeah.
to figure
Our
out.
holistic pet health coaches that are listening right now. Let's connect the seizures and the full moon. I want to hear your feedback why we continue. And we're going to bring that back up towards the end a little bit because my brain is just turning. Okay. Off of that though. So
Okay. So
anybody
that
who's got some comments on that, pull them in so we can go over them later. But the overall story is he is now doing so much better because you've incorporated these things. And that's amazing. And no
yep.
medications.
Nope. I refuse to put him on any kind of medication. So, and luckily he wasn't having them, every day. So I could afford to do that. I did get an emergency, and I don't remember, it's a compound pharmacy that does it for me, but I
Yeah.
do have an emergency, if he goes into a grand mal seizure. So I do
Mhm.
have drugs available to me if I need them. Luckily, I have never had to use them. So, I have my homeopathic remedies, I have my CBD, I have a lot of things that are in my corner that I can use on him. And each time I've been able to pull him out of the seizure. pretty quickly actually, and he gets back to normal really quickly. Like it takes him usually about a half an hour from like start to finish, and he's up and wanting to play again. So I mean it's really been good. So
That's awesome.
so he's my problem child.
I have a
And
problem child too.
then my second one is Kaylee Bailey. She is 5. She is my foster failure. So we were never supposed to keep her, but she wormed her little butt into our hearts. So
we tried to get pictures. This is my next thing besides getting a ringtone, I call it, for pet perks and pet peeves, is I will figure out how to show pictures on here because her dogs are so cute. 2 border collies, and then Kaylee Bailey is a mix.
Yeah, she's a border collie mix, but
okay, they're all so dang cute. Yeah. They are very sweet.
Yeah. And then my youngest is Tate, and he's 3 years old. So he came into our lives, about 8 months after Topher had passed. He's my baby, and he's just sweet as can be.
So I'm wondering, right now, if somebody came to you and had a pet that was diagnosed with hemangiosarcoma, what is some of the advice that you would give them, and where are some of the places that you can start with that? Because I really feel that this is kind of I wish it wasn't a wheelhouse that we had to have, but I feel like this is kind of your wheelhouse.
Yeah. So, I mean, it all starts with diet. They cannot be on kibble, period, because kibble fuels cancer. So, I mean, the first thing is they need to be on a whole foods diet. And I don't care if that's cooked or raw. I mean, many people have seen me answer tons of posts that says, whole foods diet, cooked or raw, don't care. You can do it yourself or you can do pre-made. I don't care. It needs to be whole foods, right? They need to be on a good, solid food base. And then with hemangiosarcoma, because it's all about blood and blood cancer, Unibial is a Chinese herb that actually will stop bleeds. So there's pills that you give. Yeah, there's pills that you give daily that actually try and prevent bleeds. But in the event that you do have a bleed, then there's like in the center, there's a little red pill that you give so they don't go into shock.
Oh, interesting.
So Unibial is a must. And then CBD with THC. So that's a little bit more complicated conversation there, but THC does kill cancer cells. And so you want to make sure that you have the right mix in there, but definitely that. And then turkey tail mushrooms. So in CBD dog health, it's the Vitality blend that you'd want to get. But that's where your starters are. And certainly there's more Chinese herbs that you can add in for this specific type of cancer. But, those are your very, very basic starting points.
Absolutely. I mean, that was a pretty comprehensive list and a great list. That was such good info, Tanya. And to follow up with that, as far as the whole foods go, so we know about cancer that it happens when there is a problem with the replication of the cells. Cancers ultimately come from the replication and what happens when something goes wrong when those cells are replicating, and then they form a cancer. So if we're energizing ourselves and feeding ourselves with the right stuff, then we're hoping that we can prevent this. Right now, and I know Tanya knows this, the cancer rate in dogs is currently 1 in 4. That is a even more staggering statistic. And part of our mission here is we want to make dogs healthier and help them live longer. And we don't know what we don't know until we know we need something different. And this is one of the things. And one of the things that we know is a dog's digestive system really hasn't evolved that much in the last thousands of years. But somehow we've gotten to a place of convenience and kibble for dogs. And I don't know if Tanya's heard my line. We know what kibble is in my world. Burnt brown balls. And it's dead. It's dead.
Yeah.
And when Tanya said kibble feeds cancer, why is that? Because it's full of carbs. And more often than not, it has way too many carbs than our puppies and kitties can handle. And cancer loves sugar. So there may be debates on somewhere on that, but from all of the research that I've done, and Tanya, probably you as well, this is where we're going with that. And additionally, turkey tail mushrooms, the research on turkey tail mushrooms and their ability to slow down tumor progression, and in some case stops it, pretty amazing. So you're really on the right track. And I want to encourage anybody, once again, if you happen to have this diagnosis in your life, or know somebody with a pet that's struggling, please reach out to Tanya, because she really knows her stuff and she has been through it, and has some great recommendations on all of that stuff. Tanya, was there anything you wanted to add about the hemangiosarcoma?
No. I mean, it's just.
Are you helping? Do you have any clients that you're working with right now that you're helping through this?
Fortunately, no.
Yes.
So,
Fortunately, yeah.
I cringe every time that I hear somebody with that diagnosis. So, obviously I want to help them, but it is a bad cancer. Some of the other cancers are a little bit easier. So, cancer, everybody like cringes at the word cancer. And it is bad, right? But I mean, some of them aren't as bad as others. And there's certainly things that you can do to try and help slow the progression of it. So I don't want everybody to think cancer, oh my gosh, my pet's going to die tomorrow, because that's not it. There are definitely things that we can do.
Absolutely. Absolutely. Well, I wanted to also ask you, Tanya, with all this experience and being a holistic pet health coach, as you're, going through this career change, you told me that you're also in IT. That's interesting. And as you're now kind of on the opposite spectrum, I feel like health and holistic is opposite of like computers and technology.
It is, yes. But I'm still using.
You're well-rounded.
Well, I'm a very analytical person. So, I mean, I like to go through the facts and try and figure out where the similarities are, where the differences are, so I'm still using that analytical brain of mine. I'm just using it in a different format. So,
that's pretty awesome.
Yeah.
I use my emotional brain way too much, just on a side note. So see, Tanya, when I need to be logical, guess who I'm going to call?
Hey, I'm just a phone call away. So just reach out.
Or if I have computer problems, which
there you go. Yep.
On the daily. Is there anything else that you would, we have a couple of theories coming in about the full moon things that we'll talk about in a second. But if there's anything, if you could just have a minute to, this is your chance to shine. What you would want people to know about you, or if you feel like there's any misconceptions about what you do, or if you feel like people don't understand, what would you want them to know about you and what you do?
So, we get a lot of posts on Facebook about, wanting us to do diagnosis on, this bump or that bump or whatever it might be. And we can't do that. Really, that needs to be a physical evaluation by your vet. So like there is a wealth of knowledge there from your veterinarian. And I would really encourage people to get that diagnosis, to go to your vet, to try and work through what's going on, but then come to us with that diagnosis so we could help from a holistic standpoint. So, sometimes you hear Dr. Ruth say that, the medication is necessary, or if you're trying to relieve pain or you're trying to relieve discomfort from allergies, like sometimes the medication is necessary until you can start to build up some of this holistic stuff in their system. So, I mean, medication isn't bad. I think it just has to be used wisely. So, I mean, medication isn't the end all be all because you're not getting to the root of the problem. So, what we try and do is we try and get to the root of the problem and then try and fix things that way. And sometimes it does take both approaches to get to a better end.
Yeah, yeah. Okay, so I'm going to pop this. That's very good advice, Tanya. And I'd agree. Once again, we're going to work together. We work together with vets. And I think when we've got brilliant minds on both sides, we've got the nutritional and integrative and holistic knowledge, and they've got the diagnostic knowledge. It can overall be a great team that is going to help our pups and our kitties. And that's ultimately what we want to do for Paws and Whiskers, right?
There you go.
Okay, so Common Creek, that's our colleague, Miss Melissa Sherman. Our ideas about the moon. So atmospheric pressure, energy, there's a thought that parasites might be more active during the full moon. Interesting. And so Kala, I hope I said that right. Kala. Oh gosh, help me there. Parasites in correlation with the whole full moon. So I'm wondering here on this coaches collab, we're going to collab on this, Tanya. I'm wondering if there was a parasitic type thing going on. I need your analytical brain here. Are they thinking that they could be releasing toxins that could possibly spur a seizure?
Yeah, I mean, I did do a lot with his liver and trying to release toxins from it.
Mm-hmm.
And so remember, it stemmed from a rabies shot. So, there's a lot that's in that rabies shot that has, toxins in it. So, I mean, it took me a long time to get him to a better state, at least from that perspective. So, I mean, I'm constantly trying to detox him and get everything out of his liver. I think I finally got him to a better place in that regards. But, definitely there's something in that shot that caused it, which could be more things getting released more during a full
Right.
moon.
That's what I'm thinking
So,
too. Yeah. If
yeah.
there's already some toxins being released or possibly parasitic toxins, and they kind of ramp up, what we do know from research is that if there are parasites present, they kind of ramp up their activity on the full moon because of that pressure and energy that Melissa was mentioning. So maybe I feel like it could be a threshold and it's just over that threshold during that
Right.
time. Okay, that's interesting. Lots of things that we can talk about. Now, just to touch on what Tanya was mentioning about the rabies vaccine reaction. This is kind of a charged topic. But as holistic pet health coaches, I think it's important that people understand where we stand, which is we are proponents of making sure that we are not over vaccinating. We're not going to say yes, no, don't do this, don't do that. But every vaccine that your pet gets is worth researching any possible side effects, any long-term side effects, and making sure that that you're up with what the latest vaccine schedule is, because there has been research that have since come out. Kind of old vaccine data is that we were vaccinating way too much, and so that's where we stand. Is do your research, be your own advocate, be your own animal's advocate. And we are big proponents of not making sure that we're not over vaccinating them, because every single vaccine has the potential for a side effect. And it's a big, every time that they do that, it's a big to the immune system. And if we have pets that are dealing with an autoimmune condition or dealing with cancer, sometimes that's not the best choice for them. Anything you wanted to add to that, Tanya?
Yeah, I mean, don't forget you do have the option to title your pet to try and figure out if they do have the appropriate immune response. So that's kind of where I'd start with. But don't forget that each state does have a state rabies law, which is one of the things that we're dealing with. So it's important to know where you stand with your own state.
Correct. Really good point. Really good point. So, should we transition into something more fun and a heck of a lot lighter than vaccines?
Sure, let's do that.
I'm gonna make I need maybe like a little song I'll sing next time or something. It's time for pet perks, pet peeves. Woohoo! Okay, so we do this every time because I think it's fun. Maybe nobody else gets as much of a kick out of it as I do, but here we are. So, pet perks are your favorite things about the pet world, stuff in your own life, your pet's life, whatever, that you just can't do without. What are your pet perks?
So I can't do without CBD oil. That is like number one staple in my house. Obviously for my seizure dog, but I mean, I've used it for all sorts of things too. And it's usually my go-to, like for, allergies, for arthritis, for just about everything. And CBD Dog Health has a couple different formulas that certainly have helped us out. So, CBD oil in good strength, that's number one. Number two is I need to have something at my disposal for diarrhea and vomiting, because stuff happens, right?
We all should. We all got to have this in our toolbox.
And like, if you don't have it available when they're doing it, then it's too late to order it sometimes, right? So I really like, it's called diarrhea relief from
Herbsmith?
the diarrhea relief. It's from the Pet Health and Nutrition Center.
Oh, yes. That's a great one.
Yeah. This stuff works. You go from liquid to solid poop in like 3 days. So I mean, that one I absolutely love. I have it in my cupboard. And then going along with that, right, I also have some slippery elm, because that can help just with some tummy upset. And of course, Soothe is the other one that I absolutely love, because it's a topical CBD and helps with a lot of things. And I've used this for own bug bites on myself.
Yeah, I use it on myself as well, because it also has arnica in it. And arnica, for anybody who doesn't know, is a homeopathic kind of pain reliever, and it dispels blood. So if you have bruising or itching, it can kind of like tamp down that response. I know it's made a huge difference in Darla this year, both the CBD Dog Health drops as well as the topical, because I don't know why everyone is so darn itchy this year. I've been talking with other colleagues as well, and I don't know what it is about this year, but it seems like all of our pets are just extra itchy. Have you been experiencing that?
Not with my pets per se, but I ended up taking in a foster about 3 weeks ago who had horrible skin issues.
Yeah.
I've been able to use the Soothe on him, and it's really made a huge difference, along with changing his diet and adding some supplements for him. But I've been able to get him from itching like crazy to calming down, that his skin can start to heal and maybe grow some hair back. So that's been a huge relief of mine, because when you get this dog that you have no history of, it's a little bit harder, but he's doing good.
Well, and we didn't get to talk about your foster dog. Tanya showed me pictures of this little pumpkin that she has had, and the pictures of his skin, it was scaly, flaky, dried out, missing, falling out. And
Gross.
Tanya,
like it smelled like yeast.
Yeasty. And Tanya was telling me about, of course, she put this dog on a fresh whole foods diet and started incorporating some of these techniques that we've just talked about. And I saw his after picture, and he looks like a brand new dog. Well done, Tanya. I mean, both for taking him in and getting him to where he is. So hopefully, I mean, I know your ultimate goal is to have him not be a foster fail, and he'll get in with their really
Yeah, no, he needs to find a home. So he's the sweetest boy, but he needs to find his person or his family. So if anyone's out there that's looking for a really good dog, please contact me, because he's a sweetheart. He's a Velcro dog. He just wants to be with you, and it's more than I can provide for him with my other dogs. But I want to get him into his forever home.
His name is Trevor, everyone, by the way. It is Trevor. And if you want to talk to Tanya about Trevor, he is the cutest guy. He really is. His little feet, he's got a little turnout like a ballerina, but he's not a ballerina. You can contact Tanya on her Healthy Paws and Whiskers website, and her email is on there. And I have included a link to Tanya's website there. Wow. This is what I like about Pet Perks and Pet Peeves too. We always find something else to talk about. Not that I
I haven't gotten to the pet peeves, right? So
right. No, we still have to do that. Okay. So pet peeves.
Kibble. Oh my gosh. If I could get rid of all the kibble in the world, that would be my ultimate goal. So
you and me both, sister.
Yeah, I mean, I think everyone on this call, that would be their ultimate goal. But if we could just wave our magic wands and make it disappear, that's what I'd love to see happen. That's just, ugh. It's disgusting.
And I can't believe I used to feed it. I mean, because 12 years ago, we didn't know.
We didn't know any better. We didn't know. And I mean, there's so many people out there that just don't know how bad it is.
Whenever I think of kibble, I go back to like my time growing up on the farm. And I grew up on a big farm in northeastern Colorado, and we loved our dogs and we took amazing care of them. We had cattle working dogs, but we also fed them like co-op special that who knows what was in that. It was probably like just chicken feet and whatever, but they survived. But they were catching rabbits and bunnies and whatever, like ground squirrels were out there too, probably some mice. So they were supplementing their diets, because I'm like, how did they live so long? They got all that extra supplementation from the wild.
Real food.
Yes. Yeah. Okay. What's number 2?
I think if we could get to a point where there was enough research to get to what's ultimately needed for vaccines. So not have all these state mandated rabies laws, and actually get to what's truly needed for each pet, and let the pet parent decide what that is, and whether that's a mandate of a titer to determine it or whatever, but just not this, hey, every 3 years you have to vaccinate because the state says so.
I agree wholeheartedly. And it's interesting. Dr. Ruth did a live yesterday with a human functional medicine doctor, Dr. Mila McManus. I hope I didn't butcher that if you're listening. And they started talking about this specifically. And Dr. Ruth was mentioning that if you've got a pet that with a severe illness, with cancer or heart disease or in kidney or liver failure, we've got vets that are refusing to see them because they won't get a rabies vaccination because the state mandates that. So the vets are stuck between a rock and a hard place. And what is the pet parent to do, knowing that this could exacerbate any conditions that they've currently got going on? So that is a fantastic point, Tanya. And it's something we've all got to work on for the love of our pets and for the health of our pets.
Yeah, absolutely.
What's your number 3?
I think that if having more holistic options available for vets in schools and teaching them about it, I think would help overall. So, I mean, even some of the updated sterilization techniques, so, vasectomies and oversparing spades, which are hard to find a lot of times for a vet that would do that. So just incorporating more of that in their schooling I think would give them a better perspective and some more knowledge so that they could help more pets from a holistic perspective.
Right. And to wrap that up, Tanya, just to kind of tie that all together as to why that is important to you, you had your dog that had his double TPLO surgery, and the theories behind that is early spay neuter is really contributing to that. Can you help me out there, Tanya, with why that's why they're contributing some of this to early spay neuter syndrome?
Because at 3 months of age, right, their joints haven't developed yet. So you're taking away the hormones that they need for that development. And it's not a good place for it to be. So I mean, really a spay or neuter should take place even further out than that, but at the minimum at 18 months. But I mean, probably closer to 3 to 5 years. Because I mean, they're still using those hormones through everything that they do. So yeah,
They are.
it's just awful to see, all these, and I help in rescues, right? I volunteer in rescues. I
Oh,
understand
that's
the
fantastic.
predicament that they're in, but they're
Right.
still spaying and neutering at too early of an age. And, I've seen the direct consequences of that with Topher and, the two knee surgeries. And then ultimately, I think that's what contributed to the hemangiosarcoma.
Oh gosh. Yeah, it's tough. I have to admit that I didn't really know that a lot of this was going on because I have mostly been helping pets with gut health and kidney health and liver health and seniors as well. But I've been working with pets recently that have double elbow dysplasia surgery by 7 and 8 months. This was mind blowing to me. And I just thought, oh my goodness. Yeah. So Sunny just said, I
Yeah, I
just
see
met
that 8 weeks
someone
old.
at 8 weeks.
Yeah.
Yeah. So Sunny, same deal with these couple of dogs that I'm working with. They were neutered at 8 weeks. And then we have TPLO and double elbow dysplasia surgeries at 8 months. And so things that make you go,
Right. Yeah.
right. Tanya, this has been wonderful. You really, you've got an amazing heart and you have an amazing brain. And I am so glad that you are part of the team. Also, I just want to mention, if any of this resonates with any of you, if you're interested in becoming a holistic pet health coach, please reach out. There are links here in the comments. We can sign up for a workshop with the amazing Dr. Ruth Roberts to find out more. And you can sign up to be a holistic pet health coach through these links as well. You can come join Tanya and I and the rest of our most amazing colleagues. Tanya, it's been a joy to have you today. Is there anything that you want to add before we say happy Friday?
No, I just want to thank you for having me on. This has been a lot of fun. And I'm, grateful that you gave me a platform to share my story because I think it is important and I want to continue to help more pets through what I learned basically through Topher. And he continues to support me to this day. I know he's still around me. So I just want to say thank you.
Absolutely. And I can see and I can feel that his legacy is working through you, Tanya. And we so appreciate your presence here within this group and today on this Coaches Collab. It's been another wonderful one. And to everyone who's watched and supported us today, I thank you again for your support for both Tanya, I, and Holistic Pet Health Coaching, and just holistic health in general, because we're all doing it for our wonderful little pets. With that, have a wonderful Friday. And as always, wishing you all positive vibes, and we'll see you next Friday. Have a good weekend.
Have a great weekend, everyone.